Hello, good evening, and a happy new year. We are so excited to be here with you with this new class, the 2026 Blueprint for a Profitable Functional Practice. If you're interested in practicing in your state or beyond, offering functional health consultations, you are in the right place. My name is Dr. Tal Cohen. I'm the educational director here at the American Academy of Functional Health. And with me, we have Dr. Chill.
Hi, everybody. Welcome and happy New Year's Eve, New Year's. It's
Yeah.
the start of 2026, or we're getting into there.
Yes. We're so excited about this coming year. And as we typically talk in this podcast, we typically talk about the clinical application, the mechanism, let's call it the root causes or epigenetic factors. We thought about how can we start, how can we, what's the best thing we can do and the best topic we can talk about to get us into 2026. And we got this, this actually concept came from most of you who have been reaching out to our team and asking, how do I, if I have zero business experience, I'm on a small budget to start my practice. Maybe I don't want a big office. I just want to do it virtually. How do I do this? And a lot of you reached out to us and asked, if I want to offer functional health consultations beyond my state, how do I do that? So we're going to talk about all of those today. And there's a lot of questions when it comes to establishing a functional or integrated medicine practice. And one of the reasons I wanted to invite Dr. Chill here today is because he has over a decade of experience with building practices and developing marketing systems. And he's been mentoring our community, our practitioners in our community, to build their own successful practice for the last few years. So when you see testimonials on our website of practitioners who have gotten the clinical training and they now building their practices, like the nurse practitioner Suzanne or Gina or other people, just know that Dr. Chill is the person that is behind it, is kind of providing the guidance, the mentorship, and the feedback so they know exactly which next step to take. They'll take them in the right direction of growing a practice. Dr. Chill, you want to share a little bit about your experience building practices?
Yes, absolutely. I started off with building a clinic in Arizona, and then I built a clinic in San Diego. And within those clinics, I also created multiple programs within those clinics. And all throughout that time, I was helping practitioners with their practices as well. I would always bring in preceptors to help the other practitioners grow their business. I eventually sold my San Diego practice, and throughout that time, I was creating and operating national online programs in metabolism, in weight loss, and then in skin health. And now I have transitioned into helping other practitioners grow, start, and operate, and then scale their practices as well. I have gone through the gamut of all of the trial and errors of creating systems, figuring out what works, what doesn't. So my mission now is to help you get there a lot faster than I did.
I can testify that Dr. Chill is, even with his description, is quite modest because I know your bio, I know your history, I know you went through a lot of trial and error, invested a lot into figuring out what works, what doesn't, with mentorships and learning marketing, and even went all the way to do a MBA degree and to learn really more about the business of healthcare and how to support growth. So I know that Dr. Chill, I know him for several years. He's been an amazing mentor in our community, and also developed multiple digital marketing systems that are bringing more clients to our practitioners. So I wanted to share from him, share what works, what doesn't work, and really take us into this is, I see this is, and I'll use the gardening analogy because my wife loves gardening. So this is in the end of 2025. What we're doing right now with this class is we're planting the seed, and we're planting the seed for a plant or a tree that will nourish us. That could be an apple tree or some sort of whatever tree it is that you want, but we have to plant the seed and continue to nourish it, so a few months from now we can enjoy the benefit of the fruit of this tree. And if we never plant the seed, if we never take the first step, then we never get there. We never get to enjoy the fruits of this amazing thing. And so this is the reason, the number one reason we wanted to do this class, is because we want all of you to have an amazing 2026. We want all of you to be extremely successful. Your success is our success story. And we know that we're going to talk a lot today about how do you create a strong foundation? What are the things that are most important? And we're going to talk about what successful practices are doing, because that's what we want for you. Beyond obviously the success of the income and being very profitable in our community, it's different in our community. Every one of you would have a different goal. Some of you want to get to $80,000 a year. Some of you want to get to $200,000 a year. Some of you want to get $200, and some people are not per appointment. Some of our community members, like Gina, the nurse practitioner, charges $800 per appointment. So it's going to be a little bit different. But we're going to talk about what are the different types of offers you can have in your practice. What's the right and wrong way? What we have found, at least mistakes that we have made, and both Dr. Chill and me made quite a bit of mistakes from my first practice in 2003. I've continuously invested a lot in the mentorship, and very similar to Dr. Chill. And over 20 years, I've made lots of mistakes. I had lots of wins. We were able to grow our practice from 6 to 7 figures. But it's really thanks to these strategies that we're going to talk about today. So we're very excited, Dr. Chill. This is actually the best time to plant the seed and to take the next step in building our practice, even if you're not going to apply everything we're talking about today or tomorrow or this week or next week. It's important for you to take the next step, even just write down a plan for you to be able to get there. So 3, 4, 5, 6 months from now, you wake up and you're living the ideal life. Like, you already slowly transitioned. You already have patients, consultations, maybe 1 day a week, 2 days, 3, 4 days a week. It's supporting your family. You're doing something that you love. You own your own schedule. You're free to go with your kids whenever they have any event or vacation or whatever it is. And that's really what we're passionate about. And you're helping patients. And this is the best time to do this because of our current status of current challenge in healthcare. And this is kind of where we start. I call this the biggest opportunity in healthcare right now, because chronic disease is where our healthcare system is struggling the most, right? We have applied, very interestingly, an acute model to chronic conditions for a very long time. And we're starting to see the statistics coming out of more and more patients that are struggling with multiple conditions. For example, the The CDC reports now that 6 out of 10 adults have at least one chronic condition. There's another survey from 2019 to 2022 that came out and showed that close to 70% of patients with chronic diseases report dissatisfied with the conventional care. And so things like repeatedly having to explain the same story, wishing the clinician had more than the 7 to 10 minutes insurance model, leaving the appointment confused and not understanding what's happening to their body, why they got sick, or feeling alone trying to manage their symptoms, their persistent symptoms. And all of that really leads to the biggest opportunity, which is offering them a unique service, not a commodity, but a unique service that addresses or help them to find the root causes and what can they do to restore their health. So,
the system is not working, right? The standard care is not working. It's great at acute care, right? But it's not working for chronic care.
Yep.
And the majority of the practitioners that are coming into the academy, when I do the onboarding calls with them, right? These are nurse practitioners, pharmacists, physicians, nurses. They all are coming from that conventional model. And the number one thing that they are constantly saying to me when I say, what brought you into functional medicine? They're saying the current system is not working. And I am getting frustrated with it, and my patients are frustrated, and I want to be able to provide them with an alternative and more options and things that actually work for chronic care. This is the opportunity that Dr. Cohen is talking about, right? There's a massive opportunity in healthcare for practitioners like us to be able to serve this underserved community. This is an underserved community, and that's the general population, because there are more patients now that have multiple issues, multiple conditions, and these are all they're starting to become chronic for these patients. And what is occurring is this acute model, this acute standard of care is not serving this chronic patient because it's a different system, it's a different model. And chronic care needs to be where we go in deeper with the patient, and it's not these 7-minute models that we're seeing with this acute care. And so this is all about being able to serve this community more. And this is where this opportunity lies.
Absolutely. And by the way, we're not just talking about patients with autoimmune conditions or, extremely complicated patients with multiple cardiovascular or neurological conditions. We're even talking about simple, so-called simple conditions such as metabolic conditions. Like if you just look at, if you look in the more of the, if you zoom out and look in the more public health eye, but what's really going on in the United States and worldwide, by the way, we hear the same thing from physicians and other healthcare practitioners from our community members abroad. You would see a completely different picture than what most of us believe it to be. I'll give you one simple statistics from diabetes. According to the CDC, every year, over 95,000 patients are dying because of the complications of diabetes. That means that every day, 260 patients with diabetes die. Every day, 260 patients with diabetes die because of the complications of diabetes, which is, by the way, diabetes type 2, it's a metabolic condition, and we have seen many patients that have reversed their situation, or you can call it, went into remission. But we've seen patients that went into remission or reversed this condition, and they're no longer taking medication. They're no longer taking metformin, and they're doing very well. And so this is many of the conditions that we are seeing, chronic conditions that we are seeing, we can help those patients to improve tremendously. Patients in chronic pain, patients with neurological conditions. There's so much we can do to help these patients. And that's really why we're so passionate about this, because building a more successful practice is not just about more money in our pocket. It's mostly about helping these patients that otherwise they're just bouncing from one drug to the other, and they keep slowly progressing down the disease pathway, losing function, losing their ability to take care of themselves or their families. And unfortunately, many of them end up dying because of these complications of these conditions. Here's an interesting picture from in regards to Medicare patients. This was published by the CDC and Circle Link. You can see the illustration. It's a little hard to see, but about 2/3 of Medicare fee-for-service beneficiaries live with multiple chronic conditions. 6 out of 10, as we mentioned, have adults in the U.S. have one chronic condition, and 4 of them have 4 in 10 have 2 or more chronic conditions, and so 1 out of 3 Medicare beneficiaries have diabetes. Again, that's one of the things that we talked about. And 3/4 of adults age 60 and over have hypertension, and so forth. It's a lot of people, and this really leads this 70% frustration, according to one survey. 7 out of 10 chronic patients are frustrated. It leads a lot of patients to look for other solutions, and that's really what's going to bring them to your practice, because you're offering something unique. Let's take a look at the U.S. complementary and alternative medicine market size. You can see here from 2023 to 2033, it is projected to increase significantly, almost 10 times an increase that is projected. This is in billions of dollars, by the way, because more and more patients are becoming dissatisfied with the standard of care, which is, again, why I'm calling this the greatest opportunity in healthcare, because we are seeing practitioners who learn the clinical application of functional medicine. They learn how to use the clinical tools, the labs, the evaluation and treatment guides, and with mentorship, they start doing case studies. Within 3 or 4 months, they're already seeing patients offering private functional medicine consultations, going diving deeper into understanding what's causing those conditions, maybe nutrition, sleep, stress physiology, gut immune function, HPA-axis, toxic load, nutritional deficiencies, dysbiosis, whatever it is, dysfunctional cellular function or mitochondrial dysfunction. They're learning all of these factors, and they learn how to identify and say, this is the thing we're going to work in the next 2-3 months. We're going to optimize it. And as a result of that, patients get better. And so more and more patients are looking for this type of service because they are tired of keep going back complaining about the same exact symptoms. And if you're in healthcare for long enough, you start noticing it. You start noticing how many of you have noticed that there are patients out there that they start with like 1 or 2 drugs, 10 years later, they're on 7 or 8 or 12 drugs, right? I can raise my hand. I've seen so many of those patients over 20 years. It's insane. Mm-hmm. And also, of course, we know that this is quite profitable. Dr. Chill was mentioned in the industry salary survey from 2021 to 2022. Dr. Chill, you want to mention that?
Yeah, so this is just like an income snapshot at what functional health coaches are making, functional nurses, and functional physicians. And I get asked this a lot in my coaching sessions. How much should I be charging? What are the typical salaries, right? And this is just a range. Oftentimes, we will see our coaches, our practitioners making actually even more than this, right? So with health coaches, there's a range between 75,000 to 150K. With nurses or nurse practitioners, we're seeing them in the range of 120 to 300,000 a year. With physicians, we're seeing them at the 200 to 500K range. And this is when they have a strong foundation, right? And that's what we're giving to you today, which is the blueprint and a foundation to be able to make these numbers and actually beyond that. For me, 2026 is about expansion, right? And in order to be able to expand and grow, you need to have a strong blueprint or a strong foundation. And that's what we're going to be going through with you today, is to really build a strong foundation. And how can you expand your scope? That we're going to go over some of the basics so you understand the core concepts and how you can offer this to this underserved community, so you can start to take, as what Dr. Cohen was saying, this massive opportunity in healthcare right now, and how can we be a part of that opportunity and actually serve more to this community.
Yeah, absolutely. And by the way, I wanted to credit the source of this information. This is from the industry salary survey that was done 2021 to 2024. It's not coming from us. It's coming from, I just want to give credit to the whoever has made those surveys available. From our perspective in our community, the survey that we have done in our community, the range per appointment is between $200 to $800 for nurses, nurse practitioners, and physicians, who are majority of them. And then we also have a few pharmacists as well, and PAs in the program. They're all doing amazing work. So now that we kind of establish why is it that functional medicine is so critical at this point, where so many patients, chronic patients, are struggling with their conditions. As a disclaimer, of course, we are not offering functional medicine as a replacement for primary care. Primary care is needed to manage those conditions while we address the underlying factors that cause the dysfunction, the dysregulation, whatever that is. If it's weight gain, if it's diabetes, if it's a certain cardiovascular, neurological condition, whatever that is, right? But we really have the tools to guide the patient and tell them, okay, listen, this is what we need to adjust in the next 2 months with your lifestyle, with your dietary choices. This is what we need to adjust, add certain maybe nutraceuticals or supplements or botanical medicine. This is what we need to support healthier function so we can start restoring your health. So now that we established that, let's go into what are the 3 important steps that we want to take when we're building a successful practice in 2026. Again, we're planting the seed for this amazing tree to grow, right? We're doing it now in the last day of 2025. We're learning the concepts so we can take the next step, 2026, build an amazing practice. Even if you do it on the side while you keep your day job and you just build in it like one afternoon a week, that's okay too. That's how, in fact, many of us have actually started, right? I've actually started. I had a job. I was working in a clinic while I was working for somebody else, while I was slowly building also my own private practice. I did some consultations. I learned the strategies. I grew my practice, and at some point, I did what I'm really passionate about doing, which is guide patients towards better health. So let's talk about what is the first step. And this is understanding your niche, ideal client, and offer. This is step number 1 in building a strong foundation. Now, you might think to yourself, Tal, why don't we start with talking about, my website, or what do I need to do and how do I get patients and all of that? We can definitely talk about that, but without having a strong marketing foundation and understanding exactly who it is that you're serving and what it is that you're doing with them, it's really hard to get clients, because if you don't have a focus, we don't want you to be all over the place and a very wide, broad generalist, right? And so let's take a look at this interesting picture, and that kind of summarizes the three concepts that are really, really important. And even if you just take today with us together, just 5 to 10 minutes to think about those, write them down, you're already planting the seed of success. And so the first one is the niche, which is who do you help, right? Who do you help? The second one is your ideal client, which is who is most likely to succeed, who is ready to make that next step. And then the offer. Offer is really important. We're going to expand on offer in a minute. Dr. Chill, I know that you are actually doing this work with many of our community members, one-on-one and as a group class. Would you want to take us into those three important foundational steps?
Absolutely. This is extremely important because you want to have really consistent and clear messaging when you start to go out to the community, when you start to market, when you start to post in social media, right? If you don't have a clear understanding of who you help and how you help, your potential clients are going to be confused as well. And when they're confused, they don't convert. And so we want to clear that obstacle and show you how you can make this really clear in these three ways, right? So you want to go into your niche, your ideal client, and then your offer, as what Dr. Cohen was just showing you. So your niche is a specific group of people that you help. And this should be very specific. And with the niche, what you want to look at, is there a real need? Is there an urgency to that need as well? So this is a great example. Women 35 to 55, it's really specific, with fatigue, weight gain, and hormone symptoms, right? And then you could even dive into that even further. And you could even dive into some of the pain points of the hormone symptoms. And this is what's creating the need, the urgency. What you want to have is where the patients say, this is an absolute need of mine. I need to fix this now, right? Another example are busy professionals that have high stress and they want to optimize their work, right? Or another great one is going from diabetes and even expanding on diabetes and talking about diabetes with chronic pain, right? That is diving into the need and the urgency in diabetic care. That is what I'm talking about with niche, and even diving further into the urgency with who you're helping in that niche. The other thing is your ideal client. When I work with practitioners, what I tell them to do with figuring out their ideal client is to picture their favorite patients or their favorite clients that they love to work with. Then they figure out who they really are, right? What their behavior is, and then what they're really wanting. And they can even go out and ask them specifically what they're really wanting in their health goals. And usually, if you're a great practitioner, you already know that, right? And so for me, when I was working in my skin health clinic, I had a group of patients that I just loved, and they were my ideal client. And so that is what I used to figure out what my ideal client is. And what this is really helpful for is that when you start to create your marketing and your messaging, you put those patients in your mind and you're speaking directly to them. And so when you start to create your content and your copy, you have a picture of your ideal client in mind, and that's who you're speaking to, because these are the patients or the clients that are going to most likely succeed. And what are you trying to do when you are marketing? You're trying to get those ideal clients, and the way to do that is to speak directly to them. And then the other thing that you need is to have a strong offer. This is the type of structure of care that you're going to deliver, right? Is it going to be a one-time consult? Is it going to be a package? Is it going to be a membership? Is it going to be a group program? Is it going to be an online course? Or is it going to be a combination of a few of those, right? Here is an example of a practitioner that has a really, really great, what we call promise statements, right? Where it goes into their niche, what the patient is struggling with, and how they help. And you can see on here that the practitioner's name is Ayana, and she goes into the niche. I help women and men who struggle with chronic dieting and disordered eating and body image concerns. And then their solution is to help them make peace with food and their bodies. That is a really, really strong statement. It is speaking directly to their ideal client. And then it goes into the offer, which is helping them to make peace with food and their bodies. And that is what you are trying to do with the niche, right? And what your ideal client is and the offer. And this is what you need as a strong marketing foundation before you get to anything else.
Yes. And I'm so glad that you bring this up, Dr. Chill. This is important not just for we give you example of a website, but this is important for your even personal communication. In your first time you walking into a room, is to introduce yourself in like 30 to 60 seconds, who you are, what you're passionate about. It's the best way to connect with potential patients. If you're doing a short consultation, if they show up for a short visit, if they show up for an evaluation appointment, always introduce yourself. Always use this script, this framework of who I am, what I'm passionate about, and what type of patients I work with, because that will present you. That's the first step in presenting yourself as an expert in this particular field. And I wanted to show another example from one of our graduates. This is Zerla. So she's a PA. She was working in urgent care as a primary care practitioner for several years. And when she first reached out to us, she asked, how can she build a virtual practice? She didn't want to invest money into an office. She didn't want to commute anywhere. She just wanted the comfort of working from home. We showed her the steps. She did the clinical training with us. We gave her the tools that she needed to start, and she started fairly quickly. All you need really for a virtual practice is the right strategies, the guidance, and other than that is really just a computer and internet. And so Zerla, you can see the same framework here on her website. So I'm Zerla, your functional health practitioner. I'm on a mission to help her ideal client, which is perimenopausal women and beyond. To what does she help them with? What is the desired thing that they want to achieve, right? Reclaim their energy, confidence, and sanity without the guesswork, right? And then she's talking about, the stubborn belly fat that won't budge, the emotional roller coaster, the next level exhaustion, all of the stuff that are bothering them. And then she goes into, here's the truth. Band-Aid fixes, and it's just your age aren't the answer, right? You're not crazy, you're not broken, and no, antidepressant isn't always the magic fix, right? And then she goes into, in the last section, into here's a better and smarter way to actually help your body to improve function, to improve your health, and doing it without more drugs. So that's how Zarela is getting paid for her appointments, and she's got a busy schedule, and she just loves what she's doing. So that is where we want you to be in 2026, and this is really great example for this kind of a framework. So now that Dr. Chill has talked about the initial framework of really understanding, diving a little bit deeper, now we're going into your offer. So which means, like, what are you actually offering those patients? Your offer is one of the most important thing that we have when a patient shows up. It is tied to your how long the patient stays with you, which also significantly impact your clinical results. And second to that, it also a major indicator of your financial success. So there are 5 different types that I'm going to mention today. There are more types of care, but the reason why you want to go beyond, you want to understand those types, and you want to go beyond the one-to-one consultation, is because the one-on-one consultation it's something that we cannot scale. It's hard to scale when we are constantly exchanging time for money. So the next levels of care pyramid are there to help you to serve more clients, gain more freedom, while making more profit. So you can see in this pyramid, it's a little hard to see, but hopefully you got a screen at home that allows you to see this properly. So on the bottom, you have the consults. This is the highest touch point, but it's also hard. It's also impossible to scale because you're doing one-to-one. Again, as I mentioned, you're exchanging time for money. Now, even if we teach you functional medicine and you're going to be getting to $250, $350, or $500 per appointment, you're still exchanging time for money. So the next level is membership. Membership is where, one, you want to have a solid income coming in the beginning of every month. So, for example, one of the nurse practitioners who was in our functional medicine program reached out to us, and she said, I'm in the process of opening my own practice, but I want my income to be consistent. Like, I don't want ups and downs. I want consistent, and I want slow growth with consistent. So what we end up finding out that the best form of care and model of care would be membership. So we got her a few scripts. We showed her how to build a membership and how to promote it. And every person that comes in for their initial visit, now they're also offered this membership. So you can do that in your practice. Now, of course, not everybody's going to say yes, but what we found was really interestingly is that she positioned herself as an expert, she had a unique service, functional or integrative medicine. Now patients are interested in doing the work for the long term. So now her memberships is $313 a month. And that's Suzanne. You can see her testimonial on our website and learn more about her practice. And Suzanne essentially gets paid $313 every month from those patients. They have access to her. There's different things that the membership includes that we help you bring forward, different benefits, unique benefits that patients don't get anywhere else. And they don't cost you any more money to offer them. And so patients get amazing benefit. They have access to her. There's certain guidelines, of course, to make sure that she's got her personal time and patients don't reach out after hour. And now that led to consistent revenue and a full schedule in which she's now getting paid consistently and growing that slowly, right? So think about for every 10 patients, that will be over $3,000, right? So with such a membership practice, you really just need 40 to 50 patients a month to bring that $12,000 to $15,000 a month, and you can be working 4 days a week. And so that's really where the membership is there for. Now, next level from that is groups. Groups means that you're doing a session with, instead of one-to-one with patient, you're doing it's like a topic focus. So for example, in my practice, our group sessions were diabetic neuropathy. A lot of patients are struggling with diabetic neuropathy. We had so many patients show up. Sometimes we would do these events. My mentor used to teach me how to do these events, and we teach you as well. So we used to do this like online event or in person in the practice. And we would sometimes get like 30, 40 people just showing up, telling us stories about they're maxed out on gabapentin, they've tried injections, they tried physical therapy, they can't sleep at night. So just terrible stories, right? And we want to help those folks. So we used to do a group sessions where they pay less, but we make more, because instead of 1-to-1 and you charge them $250 or $300, you get 10 people that you work with, and you educate them about self-care every week, and maybe it just costs them like $65 a visit, right? And that $65 times 10 people at the same time is $650 for you. In the same amount of time that it'll take you to do one person, you're talking to 10 people, right? Of course, there's certain guidelines we have to make sure that when we run a group, but we can help you with that. Next level from there is programs. Programs is structured curriculum. So that's where you can have recorded classes. You can have a patient show up for like 4 months or commit to 6 months. This is longer commitment, but higher, typically much higher clinical impact. It is also very profitable because the patient pays either in advance or in a payment plan. And this is what I would say the most successful practices that I've worked with that are making 7 figures, that are making $2, $3, $5, $10 million a month offers programs as well. And this is something that we can help you set up. We can help you develop. And then the on the top is I would say, the level of self-care courses. Now, self-care courses, that's really one of the top, I would say, most scalable. That's why it's on the top, because it's most scalable, because at that level, you're not exchanging time for money anymore, right? So for example, for one of our programs, the treating joint pain in my practice, that was like for patients, we established it for patients. It was recorded classes. They would join in, and then they would essentially learn how to do self-care. That was also our way to make it more affordable for practitioners across the nation. And if they needed supported questions, something like that, we're there for them. But that's, to us, that really was the minimum investment of time. But we would get clients enrolled. You get clients enrolled every week or every month. Even by talking to a client of us that showed up for an appointment and they say, I've been struggling with this back pain for a few months. I don't know what to do. Oh, well, have you checked out our Treat Back Pain course, right? And then they would check it out. They would pay maybe $150. They get access to like 10 classes, and they watch it. They apply it. They ask, if they have questions, they ask us. But that's something that we set up, and we would get that income coming in all the time. On top of this, there's a few things that we didn't added, which is the recurrent revenue from patients buying supplements or labs. There's a lot of other things that could be hundreds or thousands of dollars of additional income. So I just wanted to share a few of those because the most important thing that we want you to do when we start working with you in 2026 and helping you build your practice is we want you to have 2 types of offers. And Dr. Chill, you want to talk a little bit about what is that common mistake that most practitioners make here?
Yeah, is to out of that list that you showed, and there's many more, and they can actually be personalized to you and your business, right? And that's what our mentoring is about, is to figure out what are the specifics of your business? What are you wanting for your patients? What is your ideal client wanting, right? And you should know all of that while we go into these sessions, right? And that's going to help us go into one of the most common mistakes that are often made with practitioners, which is they're only having one offer. And a lot of times it's a one-on-one. And as Dr. Cohen was saying, that is not scalable. And so many practitioners are getting burnt out by just doing one-on-ones. So you want to have a mix of, if you're doing one-on-ones, right? You might want to start thinking about maybe doing an online course or a program or a group session or a membership. And then you're offering those variations, right? And you can say, hey, I have a membership or one-on-ones. What's going to be better for you? What would you like to do? And a lot of times I have the practitioners start off with their higher tier aspect or their higher tiered package, whatever it may be, whether it be the group, the program, or the membership, and then say they also offer a one-on-one consult, right? Or it might be that they offer a membership where it's a monthly membership and they have a high ticket program. They start with the high ticket program and they say, they go into the information of the high ticket program. And then they also say, here's your other option, which is a monthly membership. It's really giving your patients more options. And what's great about these options is that it actually enhances their care because they're having many other resources and then they're having multiple touch points with you. And then it also is saving you on your time. And we'll get into all of those little details in our program with you.
Yes, absolutely. And this is something that, by the way, if you're thinking to yourself, like, how do I put all of this together? You don't have to worry about that. We have a workshop that we actually take you step by step. We're going to have one of those workshops in January. It's going to be open to every practitioner that is in our functional medicine program. We're going to go over each one of those with you, and we're going to spend time together to put all of this together. And again, it's really important because we're seeing so many practitioners who want to do good in the world. Their heart is in the right place. You're here because you want to help patients. But we also have to make sure that we protect your time. We have patients that value your expertise. So we have the right patients in front of you and are ready to pay for it. And then we also want to make sure that we have at least 2 offers, because you don't want, if you only have one offer, then they're only basing their decision on, should I work with you or not? Let's say you go out, you learn the clinical, we teach you the clinical framework. You go out there, we give you the clinical tools, the practitioner protocol app. Now you have all the tools and the data available to you right away, right? Easy and fast. Patients show up. If you're their only choice, and it's weird because I actually visited a practitioner like that I've been to his office, and he was telling me that he charges $250. And I visited him, and he asked me, what do you think about that? And I was like, if I was a patient and the only thing you're offering me is another visit that is $250, I might say no to that, because to me, every visit now is $250. That's going to be quite expensive for me. So, so what other offer do you have? And in my practice, we had offers from $49 to $12,000, depending on their need, their financial situation, how much they want to invest in their health. Some people might want to do the membership, because membership, like think about Suzanne's model. She charges $300 per visit. But if you have a membership with her, you can show up 2 or 3 times a month. It'll still cost you $313. So for just $13 more, you get another visit or 2 visits extra every month, which essentially you're saving $600 every month. So we want to make sure that we have different either tiers or different models that we offer, at least 2, So then they can say, okay, you know what, according to my budget, this is what I can do for the next 3 months, right? This is the model that I can go with, or I can go with a more expensive one, or I can go with a more affordable one, but at least you have 2 options to help them. We want to help as many people as we can. Dr. Chill, what about when they make an offer to talk about the focus of their offer, right? This is something that we wanted to mention as well, which is to really focus when you build your offer, and we're going to do that together. So we're not going to get into it too much, but really focus on what is the results that they want, right? So for example, with our program, we had a diabetes neuropathy. So it was like relief from neuropathy, right? Or the metabolic restore or metabolic reset, right?
And it's really, you're talking about the roadmap to all of that, right? And giving them all of the tools. So not only are you helping them get to their health goals, but you're also educating them along the way. So this is all about long-term care at the end of the day, where they get to be empowered for their health choices, and they know what to do if they have a setback with something. And when this is life, right? We're going to have setbacks, but our job within these programs is to educate our patients on what occurs with those setbacks, and then setting those expectations. And that's what this roadmap is all about, is setting them up for long-term progress and getting to their health goals and optimizing their health goals.
Absolutely. And this is really where we are getting into part number 3, which is the last part of our class today. And this is the number one question that we have been getting asked, which is, how do I offer functional medicine in my state and beyond, considering all the compliance, ethical aspects of it? And of course, we're not here to provide legal advice for everybody, but we wanted to talk about it because we have quite a bit of experience in this aspect. We have practitioners from registered nurses who are doing functional medicine consultations, nurse practitioners, lots of nurse practitioners. I would say majority of our community are nurse practitioners, physicians, pharmacists, PAs. And so the question, can I actually do this in my state? How can I work with patients outside of my state in a form of consultation? Dr. Chill, you want to talk a little bit about that?
Yes, actually, this is probably the number 1 or number 2 question that I get asked, is how do I work in other states, right? As a functional health practitioner. A lot of the practitioners that come to this program are coming from the standard care, right? Where they're licensed and they're within a specific scope of practice. So they're in that mindset already. And with functional medicine, there is a different type of scope that we're getting into, right? And so when we're talking about this, this actually kind of touches upon what I was talking about, like for my intention with 2026, which is expansion. Many practitioners, when they're starting out, they stay within their local area, right? And then so your scope is really small. Your reach is really small. And when we're talking about getting to different levels within your practice and in your business, it's about expanding your reach. And one way to do that is to offer these services to other states, right? And this is what a lot of practitioners ask about, is how do I expand that scope? How do I expand my reach so I can serve more patients? And that's what this whole podcast is all about, is really kind of setting up the foundation. A big part of that foundation is the compliance. And the way that you're doing this is you're acting as a functional medicine consultant, and you are ensuring that they still have their primary care, because you are not replacing their primary care physician. Even if you're a physician, right, and you're working in other states. You're not acting as their primary care physician unless you're licensed within that state. This is often going beyond your license. So this is helping to expand your scope of practice without undermining your license. And there's certain ways to do that where you explain to them this is all about education, recommendations. You are not treating and diagnosing. And then within the program, we do have consent forms that you can download and utilize that goes over your scope with them as a functional medicine practitioner or a functional health consultant.
Yes, absolutely. So this is something that is really important to clarify, and this is also the foundation of how practitioners are offering functional medicine consultations beyond their states. Now, of course, there's also really great resources that we're going to mention in a couple of minutes about legal resources that can actually available to all of us in very specific states that actually talk about openly about doing this type of practice. But in general, this is something that is important to remember. When you are practicing primary care or your designated profession, you are typically within your scope. And the scope is very clearly defined, right? So if you're a nurse practitioner or physician doing an OPA doing primary care, you have certain guidelines that you follow, right? You're diagnosing and you're prescribing or providing a standard of care treatment, right? In functional medicine, this is where things are very much different, because functional medicine does not replace primary care. It does not follow the standard of care. It's a completely different model of care. It is a model that is really focused on providing guidance to patients and patient education. That's probably why we're seeing so many nurses and nurse practitioners and also PA and physicians that are doing great with this. Practitioners and professionals who love to educate patients that are doing really well, that are just excelling with this type of medicine or this type of approach, because we're not focusing on diagnosing a condition. This is very different than a patient comes to see you. They present certain symptoms, and then you look at some standard of care labs and you say, oh, these are the symptoms you have. You have high hemoglobin A1C. You have elevated fasting glucose. You have type 2 diabetes, right? I'm just oversimplifying it, but as an example, right? You put a label on it and you say, this is what you have. Here's the drug that I'm going to match to your condition. That's primary care. In functional medicine, we don't practice medicine. This is really, really important to differentiate, because we're not diagnosing diseases. We're not prescribing medications. The patient that shows up in your practice already have a diagnosis. And if they don't, you can either choose to do primary care if it's within your scope, of course, or if it's not in your scope, or if you've seen a patient from another state, which sometimes in my practice we would see patients from other states, then we would explain to them very, very clearly that we do not provide primary care services. They need to have a primary care service. And we acknowledge that in writing with a disclaimer form, and we also chart it in our notes. We documented in our notes that to protect ourselves, to protect the patient, keep the relationship ethical. That's really, really important. We don't want to mislead any patient that they're coming in for functional medicine or functional health approach, and now they don't need their medication. I've by the way, heard we had one patient that came in, and even after signing the documents, they were 4 months into it, they suddenly dropped their medication because they said, I don't need it anymore. I feel better. And we sat with them. We had the conversation of, if you're feeling better, we're so excited about it. We're so happy about it. But as we mentioned, this is something you have to discuss and taper off based on the decision of your prescribing provider. We always work together with a primary care practitioner directly or indirectly through the patient. So because we're not doing primary care, there is typically less liability because now you're not in charge. You don't have the full, it's not the same relationship. And so in my practice, for example, we had physicians, nurse practitioners, we had health coaches, we had nutritionists, we had a whole team, and we did not do primary care at all, just because we decided that we don't want to be focused on pharmaceuticals. We don't want to diagnose diseases. If we need that kind of support, then we refer the patient out. What we do is educate the patient, try to help them to identify what's causing the dysfunction, and then from there we provide guidance and education, right? And even when we recommend a certain, let's say we find dysbiosis, we find cellular dysfunction, we find there's insulin resistance or whatever it is, and we educate the patient about a certain nutritional, dietary, herbal compound that was found in research to be beneficial for that, we describe it as educational, right? So that could be, this compound at this dosage was found in this particular research within 3 months to provide a significant improvement in insulin sensitivity and support a reduction in hemoglobin A1C or level of fasting glucose, whatever the study reported. And that's what the patient is, this making a decision between themselves or together with the other practitioner, the primary care practitioner, if that's appropriate. And so that's also one of the reasons why when the American Academy of Functional Health teaches functional medicine, all our treatment protocols, all of them are based on clinical research. And that's what we show you. What's the compound, the indication, contraindication, the dosage, how long they took it, and then what the results that they got, and then where you can find this particular compound. So that's really important to understand. So when you are practicing as within your scope in a certain state, or if you're seeing a patient that is out of state, it's really important when you put on the functional medicine hat is to explain to patients that this is not the standard of care, and this is a different model, a different approach that is focused more on health improvement, finding what's causing their dysfunction or contributing to their disease, and that we're not using typically pharmaceuticals with those. We're using a different approach that is not considered a treatment in the standard of care. So this is important because patients, again, they're not looking for more drugs when they come to see you. They already tried that. They already tried multiple providers, different medications. They're really there because, one, they want somebody to listen to them. They want somebody that won't push them out the door 7 to 10 minutes later or disappear. They want somebody that will connect the dots between their symptoms and what's going on, what happened to their body. They want somebody to understand why they're sick, and most importantly, what do they need to do to restore their health. And I always try to kind of finish up with like my example of how I was introduced to functional medicine as a patient years ago. I struggled myself with chronic pain for a very young age. I developed asthma. I developed fatigue. I was put on steroids, inhalers. I constantly was upgraded. I got the shots every once in a while, and I slowly saw how my body I was losing function. I was losing function as I was progressing with all of those. And I remember that it started from a young age, and I remember the thing that is most clear to me is my frustration, going from one specialist to the other, getting another prescription, getting a different prescription, taking another shot and telling me that I just need to follow up with the treatment protocol. It's only been a few months. Well, guess what? 4 to 5 years into it, I already understood that None of that stuff was beneficial for me. Yeah, it was maybe keeping the pain at bay. It was helping me to breathe when I used the inhalers, but it was all just temporary band-aid. And I was so frustrated with the amount of time and money, thousands of dollars that I spent on trying all these different things. And as soon as I heard that there's a different approach that can help me to figure out why I'm sick, I checked it out. I was like, okay, I've never heard about it before, but maybe there's something there. Maybe there's a glimpse of hope that I get better. And guess what? Today, it's been years. I've not taken any medication, had no asthma attack. In fact, my wife, every spring, she gets an allergy attack for like a few days, and I have nothing, right? And so all I needed to do is find out what is not working in my body. Why is my immune system reacting in such an aggressive way? Why do I get this mast cell activation or aggressive release of histamine? And fix that, right? And so a patient like me, we're probably not there to treat. They're not coming in and you're going to tell them, we're going to treat and cure your asthma, right? But you're going to tell them, listen, we're here to find out what's causing your immune system to react in such an aggressive way. And let's figure out ways to calm that so you have better quality of life, right? For me, it was well worth the investment of time and effort and money that I put into functional medicine treatments. And I'm very grateful for that practitioner that was there for me to guide me along the way. And that is the highest role that we can take with our patients. And so, Dr. Chill, anything you wanted to mention on top of that, and maybe talk a little bit about the Health Freedom Act, which is another amazing way that practitioners, a state level law that help practitioners to practice functional health.
Yes, absolutely. This is really also called the safe harbor laws, and it's really talks about like the broader legal concept. And these are state level laws, and it creates a legal safe harbor for certain types of practitioners. And it's functional health practitioners, right? These are practitioners that provide non-invasive, non-medical, complementary, or wellness-based services. These are not meant to work under your medical license, right? This is not meant to diagnose, prescribe, or tell your patients to stop medical treatment. We're still working within the standard of care system, right? We're integrating into that system as well, or working in adjunct with that system. And what this does not do is does not allow you to practice medicine. It really goes into educating, lifestyle guidance, wellness support, consulting, right? Making recommendations, making sure your recommendations are based on education and the clinical studies, as Dr. Cohen was talking about. You're documenting everything clearly. You're making sure that they have a primary care physician that they're working with for the medications. You're ensuring that they're not going off the medications. You can say that this may help with making their medications more effective, but everything that you're doing, they have to still run by their primary care doctor. If you are that primary care doctor, then you have a license within that state to do that. You can talk about the prescribing aspects of that, but that has to be within your scope of practice and in your license. If you're not, you are ensuring that they are still working with their primary care physician for all of those. And that is what the safe harbor laws are referring to, or the Health Freedom Acts, right? And there are many states that have the health freedom or safe harbor type. And this is what we call the green states. This is where we typically recommend marketing to first. And these are states like Minnesota, Rhode Island, California, Louisiana, Idaho, Oklahoma, New Mexico, Colorado, Maine, and Arizona. And you can go and even Google the National Health Freedom Coalition summaries that'll talk about all of this information, or you can even look up the Health Freedom Act. It's going to go through this information for you as well. And it's going to really give you an understanding of how to practice functional health throughout the different states.
Yeah, absolutely. And this is really where it's the law is actually growing. The health freedom of safe harbor is growing. And the nice thing about it is that it's already available in Minnesota, Rhode Island, California, Louisiana, Idaho, Oklahoma, New Mexico, Colorado, Maine, Arizona. Nevada, for example, has a really good scope that is available. Like you can do detoxification, nutritional, herbal. There's all different types of modalities that you can use without even being licensed in the state of Nevada. So you don't have to be a resident of Nevada to apply those. But if you see patients, for example, if you see patients from Nevada virtually, then you just need to make sure that you're compliant with those. As Dr. Chill mentioned, these are not these laws. The safe harbor law does not allow a practitioner to prescribe or diagnose disease, but that's not what we do with functional medicine either way. We're there to understand the dysfunction and provide strategies to help them to improve their health. So that's the major way in which practitioners in our community are doing consultations out of state, right? And of course, as Dr. Chill mentioned, we have to have a disclaimer so they know if you're a nurse practitioner or a registered nurse or you're a physician, if you're not licensed in that state, you just need to let them know and have document that you're not. They need to have a primary care provider for the diagnosis and the management of their condition, right? That's important. There's really interesting, and then there's also, of course, beyond that, there's multiple, let's say majority of the states in the United States do not have, there's certain regulations that are different. For example, the title registered dietitian is commonly secure and regulated all across the United States and Canada. But in some places, the term functional nutritionist or nutritionist is not regulated. So for example, here in the Northwest, both in California and Oregon, anybody that has went through a nutritional training can call themselves a nutritionist. That's not regulated, right? Now, of course, calling yourself a nutritionist does not allow you to diagnose diseases, as we mentioned, and prescribe. You're not going to do that either way, but it does, you can allow yourself to do that. And broad nutritional education and wellness is not regulated within the dietitian scope within most places. So we are seeing, for example, I've showed you Zerla, the example of Zerla. Why is it on her website she doesn't present herself as a PA, as a physician assistant? Because she's also consulting with patients in other states. So when I showed you that picture, right, from her website, it stated she's a functional health consultant, right? So she's not presenting herself as a licensed PA because she's seeing patients virtually from multiple different states. So that's a very important distinguishing factor, that if you want to see patients from states you are not licensed in, that's really important to have. Now, one thing that I wanted to mention is we got a really good question here about nurses. Can nurses, RNs, work as functional medicine coaches without supervision? So we do have quite a few registered nurses. You can see on our website, Rose from Colorado. There's multiple registered nurses that do offer functional medicine consultation. There's actually a really good article that was published in the American Journal of Nursing, and it's called Functional Medicine in Nursing. And I'll post here the link if you guys want to watch that. But read more about it. But it's called Functional Medicine in Nursing by the American Journal of Nursing, and this was published just recently, 2024. And essentially, what they're talking about in the article about the concept of functional medicine is a holistic form or method of healthcare that is the foundation, essentially relying on foundation of patient education. And they're talking in this article about how it matches the foundation of nursing, which is patient advocate and advocating for patients and patient education. And nurses do this all the time. I talk to nurses all the time, and I ask them, registered nurses or nurse practitioner, and I ask them, especially registered nurses, like, what do you do if a patient asks you about their hemoglobin A1C or vitamin deficiency or whatever it is? And they all tell me the same thing. Oh, if I see something in their labs and they need to know, I educate them about what it is, what they need to change maybe in their diet or lifestyle. So you're already practicing patient education. Now you just need to learn how to do that, to have a better understanding of the root causes and educate the patient about it. Now you just need to learn about what are the lifestyle, nutritional, and maybe botanical compounds that could be supportive, and educate the patient. It's the same exact concept that you've been doing all along these years, but now you're doing it equipped with the knowledge of functional or integrative medicine. Right. And we're seeing a lot of patients that call this functional nursing. There's patients that are calling this holistic. The American Nursing Association calls this holistic nursing. So hopefully that answers your question. If you want us to clarify, you have any questions, let us know. Where would you find the documents like the consent form and such? We have all of those in our functional medicine platform. So log into the platform. There's lots of resources on the platform. That's also how you connect with your mentor. It's available to you. All the mentors, clinical mentors, are available to you. They have years of clinical experience. We got nurse practitioners that are clinical mentors. We got physicians that are clinical mentors. They're available to you, and it doesn't cost you anything. It's all part of your functional medicine training. Let me see if there's anything else that we wanted to cover here for today. The big picture essentially is really focus on education and guidance. Avoid diagnosis and prescription if it's not within your scope. And then the analogy that I always give practitioners is this. The difference between a licensed practitioner that is doing primary care and doing functional medicine and a practitioner who decides just to do functional medicine in their state, or maybe in a state they're not licensed in, is the same difference between a CPA, or very similar, at least, it's an analogy, between a CPA, right, and a tax advisor or wealth advisor. So I give this analogy because I actually have both for myself, and I'll give you an example. In 2019, the IRS approached me and said, "You owe us this amount of money." And I said, "Okay." I reached out to my accountant, and my accountant said, "Oh, okay, so we can revise the booking and check to see what happened there and see what, work the books." And so I hired my accountant for extra time to go over my books, right, and respond properly to the IRS. At the same time, one of my family members was telling me, you should also get, if you're in that situation, you should also get a tax advisor. And I found somebody that is a tax advisor and a wealth advisor. And it was really interesting for me because I've never worked with a tax advisor or wealth advisor. And I read a little bit about what it is and like, what is that? And what do I do with it? And how do they help me? And apparently a CPA is licensed in the state. In order to function as a CPA, which is your primary accountant, they have to be licensed. There's certain regulations, and they're the only one that can process your taxes. But a wealth advisor or tax advisor are not licensed in the same way. So I connected with this tax advisor. He gave me a quote. I explained the situation in a brief 5 to 10 minutes consultation. He told me, I'm not licensed in your state. He's from Texas. I'm not licensed in your state. And I'm not licensed as a CPA. I'm a tax advisor. My role is to give you strategies to improve your financial health. I said, okay. He gave me the quote, which is the same amount or even higher than what my CPA would charge me for a whole year of doing my accounting. And I said, wow, that's quite expensive. Like you want to tell me like I'm going to be paying here like $7,000 for this? And he's like, yeah, I'm going to pay $7,000 for this. And I was like, okay, for his guidance. And what happens next completely changed everything that I thought about this whole topic, right? The tax advisor in the following 3 to 4 months gave me 2 strategies that helped me save over $80,000 by putting some of the revenue into a retirement account. And there's different ways to do that. I'm not going to get into that right now. We talk more about that in the Practice Accelerator, where we talk about like practice growth and how to keep more of what you're earning and all of that stuff. But essentially, he gave me 2 strategies that allowed me to revise my records, add that money instead of paying it to the IRS, add it legally into a retirement account. And he saved me thousands of dollars. So here's a simple example of one practitioner is a CPA that is licensed and can have a full scope of practice when it comes to our accountant and taxes. And here's another example of somebody who works as a financial health or tax advisor. He's not licensed, but the strategies that he gave me were strategies that the CPA did not even know about. And I remember my call with the CPA. I was like, I just had this call and he told me to do this strategy and that strategy. Can I legally do that? And my CPA was like, he's like, let me check and get back to you. And then he get back to me. He's like, yeah, Tal, we can do this. And I'm like, I was sitting there thinking, why didn't you provide me with these guidelines, right? So I didn't ask him that question. I just said, did you know about these guidelines? He said, Tal, my job is to punch the numbers and process it and submit it to the IRS. Like that's what I do, right? And so that's again you are going to be, if you're practicing out of state, you're not going to be the primary care. If you have a limited scope like registered nurses, then you're not going to be the primary care provider. We already know this, but can you be the health advisor? Can you be the person that provide the strategies to the patient and support they need to get better? If the answer is yes, then we can show you how to do it, and we can show you how to get paid for these services. By the way, interestingly, we checked the Bureau of Labor and Statistics in 2024, and while accountants and CPAs make $81,000 on average, guess how much financial advisors make? About $102,000. So they make $20,000 more, and majority of them are not, when they do either tax advising or whatever it is, they're not even licensed in that way, in the same way that an accountant is. So, so with that being said, any other questions before we close for today? I know we took a little bit longer, but I want to make sure that we set the tone for 2026. We want all of you we want to help you to achieve your mission here. We have, if you have a vision of a practice that is successful, if you have a passion to do something, then we are here to help you. And I love this quote by Steve Harvey, who said, God is speaking to you in your imagination. I just love that quote, because if you have a passion to do something, it means that there's, in my personal belief, it means that either God or some universal power have placed it there, right? And that could be your purpose. So if that is your purpose, we are here to help you. We'd love to help you get the appropriate clinical training with functional medicine, be there step by step with you. All our programs get access to the mentors to show you. All our programs include the practice building workshop, and then we would love to help you grow your practice. There's a quick question here about Canadian practitioners, open telehealth practice. So of course, we have Canadian practitioners in our community. I can't think about any one particular. I know there's nurse practitioners, there's physicians that we have. And as I mentioned again, the telehealth practice, there's different regulations in Canada for depending on your location for telehealth practice. But again, if you are designated this as a functional health consultations, not medicine, not diagnosing and not prescribing, then you are essentially functioning not as a licensed practitioner, but as a health consultant, right? And make sure you have a good disclaimer. You have patients sign it, you document it, have it separate from everything else you're doing as well. This is something I learned from a local dentist that became a naturopath here in Portland. Very, very smart lady. And I asked her, I went to her as she was my dentist, and she was just across my practice, and I would go because he was very convenient. She was lovely, very, very lovely and smart lady. And I asked her, how do you do? I was like, I didn't even know she was doing naturopathy. I was like, she's like, she was working on my teeth, and she's like, Tal, I'm also studying naturopathic. I was like, wow, that's incredible. And she's like, yeah, and I'm now studying, like, I want to get into functional medicine and all of that. And I was like, how do you do that? Like, and she's like, well, legally, I have to completely separate it from my profession. Like, I can't, like, if I'm a dentist and I want to give nutritional recommendations or lifestyle or nutritional guidelines, I have to do it in a different separate day, right? So she does that. She's got certain days in which she provides nutritional lifestyle recommendations. She educates her patients, but that's separate from her dentistry. And so it's probably possible to do it in that capacity, but we always want to be on a cautious side, and then just make sure that patients know that it's not primary care. Dr. Chill, there's a question here that we're going to finish with. The first question, you can probably see it. What do you want to take?
Oh, yes. I have a telehealth clinic, but needs help with marketing. I'm not getting any patients. I was wondering how I can get help with it. By coming to these podcasts and this information, and by joining the accelerator program, if you haven't thought about that yet. And the accelerator program will give you all of the tools to help you succeed in your practice. We actually give you the business systems to do that.
Yep. So we have, depending on your focus, what you want to focus on. If you want to focus on the clinical side, we have the Functional Medicine Accelerator Program starting next week. All the classes are the classes are live, but they're also recorded to you. So some practitioners might take it kind of in their own pace. But if you are interested in the clinical, you're interested in the treatment protocol app, have treatment protocols for hundreds of conditions and symptoms in the tips of your finger. If you want to have all the clinical guides and a mentor that works with you on patients in your practice, then we have that starting. We have $1,000 scholarship right now. This is actually the last night, $1,000 scholarship for the Functional Medicine Accelerator. You get certified in 4 months, and we are still there with you for a whole year to really support you and building a practice. If you just want to focus on the practice building, check out our Practice Accelerator, where this is what we do. Like, we literally work with you on growing a practice. So it really depends on where you are and what you want to focus on. But either way, we'll be happy to assist you grow your practice. We got specific trainings on how to get clients in the door. I used in my practice there's a class called the 7 methods of getting new clients offline. So when I started, I didn't have money for marketing, so I just used those seven methods, and I grew my practice. So I didn't spend any money on marketing, like zero money on marketing, and that allowed me to get started. So it's very, very valuable when you can start getting patients in and you start seeing the money coming in, and it's quite amazing. So we'll be happy to help you either way. By the way, the Functional Medicine Accelerator and the Functional Medicine Mastery do come in with practice building classes. So if you want to focus on the clinical, we'll still teach you how to build a practice. So, okay. So with that being said, really the takeaway from this class today is know who you're serving, know how you're serving them, have clarity, know how to present yourself, and know which types of services or methods you are offering them. Always have two, not just one offers. And make sure that you are presenting yourself in the appropriate way, so we're compliant. This is, as I mentioned, we got multiple different professionals in our community, and we got clinicians across the country and abroad that are already practicing functional and integrated medicine ethically and successfully. And we provide you everything you need to get started, like all the forms, the evaluation tool, everything that you need is provided to you. So I love doing this in the last night of 2025, because I know that many of you are already enrolled in the program, and I'm so excited to get started with you guys next week. We got Kim, who's a nurse practitioner, and she's also a professor at one of the universities, and she's teaching in the program. We got amazing functional medicine physicians who are teaching in the program. All of them have functional medicine practices that are really successful. So there's a lot we can learn from them. We probably have over 15 amazing doctors and nurse practitioners that are teaching, and PhDs that are teaching in this program. So we're so excited to get all of you started and build your dream practice in 2026. Any final words of advice or wisdom, Dr. Teal, for 2026? Expansion.
Let's plant the seed, grow, and expand. Let's do this all together.
Yes, absolutely. Absolutely. We'll love to work with you in 2026. And we're planting the seed. This is where we're planting the seed and enjoy the fruits of it in 2026. So I want to thank Dr. Chill for being here, for sharing his years of experience. And I want to thank our media team for their work that they're doing, and the entire team, medical team, presenters, everybody that's been putting in so much time and effort in coaching one-on-one and helping practitioners to build practices and building the materials that we had all year, the presentations and the summits, and it was an incredible year. I want to thank all of you for being here and making it possible, for trusting in us to provide you with valuable information. And again, I want to thank you for being there for your patients. Thank you again. Have a blessed year, an amazing year. And we're here for you. Let's do it together.